Hello, I'm Steve, here with Dr. Nario with Biointegrative Health Center. Dr. Nario can be found online, Biointegrative Health Center in Reno, Nevada. You can look them up and see what kind of treatments and what they do at their clinic. So, hello, doctor.
Hi, Steve. Thanks for the invite again.
Okay, so let's talk about oxytocin. What is it?
Yes, so this is one of the things that we're using now in the clinic, and I want our audience to be introduced to this. So oxytocin is one of the first peptide hormone to have its own structure determined and first chemically made in a lab. And when we hear this word, it's related to a medicine given to pregnant women who is in labor. It's called Pitocin, and it's used for women who's having a hard time during labor to contract the uterus to help in delivery. Basically, this is the one that actually helped your mom kick you out of her uterus. And this is a naturally occurring hormone. It's a peptide, a neurotransmitter produced in the brain, and it helps modulate and regulate all our enzymes in the brain. And again, so going back to the females, this is also a primary hormone released during orgasm and causes new moms to form loving bonds with their infants after birth. That's why the name, the cuddle hormone. And okay, you can also apply this for, of course, adults, but later on we'll go deeper into that. And works by a positive feedback, meaning the more oxytocin you release, the more is produced. So the more, the better. And daily production in adults between 1 to 2 units per day, and higher amounts have been seen for people who engage in higher sexual activity. So as you can see where this theme is going, it's almost like the love hormone. And doses as high as 5 to 10 units, international units per day, have been found to be produced also when women are breastfeeding.
Okay, so that gives us kind of a general overview, but what can we expect? What are the functions? What are all the different things that oxytocin does? Is it important? Why do we need it? What's it do?
All right, Steve, the most common function of oxytocin, as I mentioned a while ago, it helps in delivery of birth. And also, I mentioned a while ago, bonding between mother and baby. This is the one that stimulates breastfeeding and also increasing the trust, the deeper bond seen in mother and child. So now let's apply this to people who are taking it, who are not pregnant, who are not giving birth. So when somebody takes oxytocin, it improves social interactions, increases friendliness, improves mood, makes people smile more, reduces anxiety, especially in the social encounters. So after sex, you always feel like, oh, you're on top of the world. This is the reason why. So oxytocin is something that we should be thankful for. And physically, there are other benefits, not only for the ones that I mentioned, but it promotes the vasodilation of the blood vessels and arteries to the heart, preventing heart attacks and strokes, and also lowers blood pressure and speeds up wound healing, most likely because it pushes in more blood to that injured site. It also relaxes muscles and reduces pain, may even help with fibromyalgia. And again, going back to that sexual benefit, so sexual speeds up orgasms and increases attachments between lovers and partners. And also for women, it increases vaginal lubrication, stimulates a sex drive, and increases the pleasure for both of orgasm for both male and female. And increasing also for men and women, IGF-1 and testosterone, but mostly for men, and reduces stress and cortisol. So the wonders of oxytocin right there.
Okay, so it's going to help your hormones. So I might be able to guess, but just from what you've said so far, but how would we know? What are the signs of this being low or being deficient of oxytocin? Would it be the opposite of everything you just said? But how would we know if we're deficient or if maybe we would need this?
Right. So again, you're right. Basically, you're going to think about the opposite, but in a more medical sense, yeah, blood tests can be done, but most of the time it's hard to do a blood test on this. And we usually more of rely on a symptomatology of the patient. But let me tell you this, Steve, oxytocin declines with advancing age and cells becomes less responsive to it. That's why there's less production. And of course, when it goes down, there's a decrease in affect and the emotions. And also, uh, as I know, I mentioned, aging is a big part of this. The elderly, so as we increase in age, the need becomes higher in terms of to stimulate the receptors to give sufficient effects again from where they were when we were younger. And also, chronic stress and brain trauma does this. And because the source is of course in the brain. And science, so science, let me just so everybody would not have to think about the opposite of what I just described. Men, lower sex drive and arousal, few or no ejaculations, lower ejaculation volume, and poor sperm count. When they feel that sex feels not physical, I mean, just physical and no emotional attachment to the act, and on no intense romantic love experience. For women, absence or even rareness of orgasms, at least longer, more than 20 minutes to achieve orgasm, lower to I mean, from their baseline, they feel that the orgasm is lower in terms of intensity, and the absence of multiple or the ability to have multiple orgasms, and mental complaints, both for men and women. Majority of the time, when you have low oxytocin, irritable, affectionless, low mood, no intense joy, introverts, suspicious. And major disorders, if you have chronic and very low levels, would be cardiovascular diseases, even myocardial infarct, or MIs or strokes, lower fertility for the ones who wants to have a baby, poor wound healing, depression, anxiety, sexual impotence, even worst case scenario, autism, fibromyalgia, and Parkinsonism. So you might be thinking now, man, probably everybody has a low oxytocin level.
Okay, so is there something we can do to naturally increase oxytocin?
So yes, we can, Steve. So number one, as I always advocate for, lifestyle changes. The thing here is, okay, some would be deviating away from beliefs of other people, but prolonged fasting is something that affects oxytocin and it lowers the levels down. A good diet for you to promote this and this hormone is paleo diet, which is majority of the time fruits, vegetables, meats, poultry, eggs, and fish. Eating organic, more social interaction, more social contact with family and loved ones, hugging your partner on a regular basis. Your partner, not that, well, of course, COVID now limits our hugging and interaction with each other. Massages, not only stimulating or relaxing your muscles, but also stimulating the oxytocin release. Of course, sexual intercourse frequently. Who doesn't want that, huh? Moderate exercising, reading, music, even singing, relaxing activities, and just anything to avoid stress. Smoking, avoiding smoking and tobacco, and even alcohol and drugs. Avoiding caffeine, sugar, sweets, soft drinks, pasta, and bread. So basically, what I just described right there is eating a healthy diet and also having a healthy lifestyle, as we speak during our interviews.
Okay, so that's interesting. This oxytocin stuff is like rated X. So is there a way, like, would somebody need, and it's interesting, it sounds like a lot of this comes from your mind, your brain, to increase it naturally, just consciously doing certain behaviors. But let's say it's low, and like I know, like somebody's testosterone may be low, you do a testosterone replacement. Is there a such thing as oxytocin replacement? Are there ways that you can do that or balance it out, or tell me?
Right. So, Steve, that's correct. So when you talk about balance, I don't know, you're confused. Like people can get confused. Like, is it my testosterone? Is it my oxytocin? Right. That's a thing. I even end up sometimes giving patients both. So that's a very good point because the symptoms overlap. But directly to your question, Steve, the replacement, we have oral, sublingual under the tongue, sub-Q, which is injection, but the most common ones that I use is oral and sublingual. You have to remember, this is a prescription. It can only be compounded in a pharmacy. And so when I talk about oral, the ones that I usually use a lot of is the oral version, which is slow release, though less efficient due to the metabolism of the liver and passing through the gut. And majority of the time, our guts are not really the best. Everybody has bloating, everybody has gas. So absorption is altered when it goes through there. But when you use oral, I use it most of the time for mild fibromyalgia, people going through social events if they don't want to have that anxiety, and even improvement in just stability in social situations, or somebody wants to have a romantic evening. The one that I use a lot of is the sublingual. It's quicker, more stable absorption, and it's like quicker on and off. If you want it now, and then if you're done, it's out of your system. Part of it is absorbed by the mouth or with the blood vessels in the mouth called buccal mucosa, and the rest again is absorbed through the gut because it's going to spill in the back of your throat. So this is superior to oral. Best use, or when I use it more, is again social improvements, anxieties, increased romantic attachments. Again, if you have a date, somebody's going out, and when you have low mood, and I've seen autism benefit from this, schizophrenia. Men, we have to make sure also that if they want better ejaculation or orgasms, and same for women when they want higher intensity and multiple numbers. But I don't want to put in everybody's thought process that this is a safe medicine. That's why you need a medical professional for this, for the reason that there are contraindications, such as allergic reactions. You cannot give this to somebody who has low adrenals because it can lower down. As I told you, it can make you stress-free. Adrenals will just go bottom out if you are already dealing with that. And then it can also cause water retention. So that's why I'm careful for patients who has leg swelling, and can cause drowsiness because it's a brain hormone. And it's you have to be cautious about somebody who has prostate enlargement and also infections in the prostate, because it can actually aggravate these prostates temporarily. And of course, men, that goes fast, who has premature ejaculation. That's why you don't want to be a 1 minute man. You want to be going longer. So if you use this on these patients, this condition gets worse. So avoid it in these specific situations.
Very interesting. Okay, Dr. Nario, thank you. If any of you out there want to know more about oxytocin, you can find out at Biointegrative Health Center or any of the other treatments that they do. So thank you, Doctor. Biointegrative Health Center in Reno, Nevada. Thanks for joining us again.
Well, thank you, Steve. Again, as we all know, the knowledge is power. And thank you for letting me provide you with edge in longevity and health maintenance, which I call the biological edge or the bio edge.